Okay, good evening. Thank you everybody for joining us for this evening's webinar. We'll be going through specialty training for ST1 and ST3 from a recruitment point of view. So I'm pleased to have a couple of colleagues with me. I've got Blanche Lum, who is our trainee rep for recruitment at the college, and also Simon Broughton, who is our officer for recruitment as well. So we've got some slides for you, and hopefully we'll have a good chance for some Q&A at the end. So do use the Q&A tab in the middle. If you can avoid asking kind of questions that are very specific to kind of personal circumstances and so on, we're very happy to take them sort of via our inbox. But we'll try and keep this a sort of much more sort of explanation of guidance level and so on as much as possible. But hopefully we can help you all out and give you what you need to apply to ST1 and ST3 over the next few months. So we're going to cover something new to look out for ST3 and ST1 for this year. We'll be covering the eligibility criteria, and then we'll go through the various stages of the recruitment process for getting into paediatrics. There's going to be some hints and tips as well on completing your application in particular. And then we'll just have a run through sort of some final points around the time frame and additional guidance. As I say, hopefully we'll have plenty of time left at the end for questions. So just something to look out for 25-26. So just to say that ST1 and ST3, the application process, the interview process has not really changed at all. The one change is within the format of the shortlisting and application form, white space areas as they are often called. So this is something which is being rolled out across various different specialties, across our subspecialty place recruitment as well. And essentially what you'll find is that there are no more long white space answers. So you're not going to have lots of boxes to write 500 words in and so on. You'll now have much smaller entry points to put your examples into. Some bits maybe via drop-down boxes as well. And essentially, as applicants, you'll be asked to identify your best examples of the various skills, attributes, and experience against the scoring criteria, which are currently on the website as well. There won't be a supporting statement either. Essentially, we're trying to sort of do a few things with this. We're trying to look to make the application easier to complete and allow applicants to focus on their best examples. Try and make it easier to score and also clearer and less subjective to score as well. So it's basically looking at trying to sort of take those 500-word answers that you used to be asked to complete and actually pull out just the facts and put them down so it's a lot clearer. Simon will go through that in a little bit more detail later on. But essentially that is the only thing that's changed this year for the 25-26 round, as it's called, for either ST1 or ST3. So I'll say we'll go back to that a bit later on. So eligibility. So you've got your basic points of eligibility for both ST1 and ST3 are on the screen there. So the things just to highlight there really are for ST1, this is something which was brought back last year, is the maximum paediatric experience. So if you're applying to ST1, you can have up to 2 years in any paediatric type post outside of foundation, but beyond that, you will now not be eligible for ST1 application. So there's still no particular requirement for any level of actual prior paediatric experience if you're applying to ST1. But it's just to try and sort of limit the amount of time that people have spent so that actually you're applying to the level that's right for you. So if you've got sort of more than 2 years paediatric experience, you should be looking to apply to ST3. And that gives you hopefully the much easier task of only applying to one of the two. You could still apply to two if you wanted to, but actually hopefully this makes it a little bit easier for you to choose. So maximum of 2 years there. I say anything that is a paediatric post. So if it's something where you just come across working with children, like in an emergency department or something like that, that's not going to be classed as a paediatric post. However, if you're specifically working in the paediatric A&E, then that would. So that's the kind of sort of difference between what we will count and what we won't. it's got to be at the point of application as well. So you could end up doing a little bit over, obviously, if you're in the middle of your sort of a particular post. But at the point of application, you can't have more than 2 years. And then for ST3, which is currently the only other entry point into paediatric training, higher than ST1, you do need to have completed 2 out of the 3 written MRCPCH exams. So the membership exams do form part of the training pathway. Our curriculum changed last year slightly to Progress Plus, the new very capability-based program, which is nominally 7 years. So you do need to complete your MLCPCH by the end of ST4. So obviously coming in at ST3 without any parts of the exam will make it quite tricky. So we do need 2 out of 3 exams, written exams passed. When it comes to experience limits, you need to have had at least 12 months to apply to ST3. Chances are, say, sort of from the ST1 note there, you probably will have had a little bit more. The one stipulation is, though, that during that paediatric experience, that you've spent a minimum of 6 months in a general paediatric post and 6 months minimum in a neonatal post, because that'll ensure, therefore, that you do come into the training program on a similar kind of level to all the other people that will be in the training program already and have been in since ST1. Whereas you do need to demonstrate your foundation competencies for ST1, you need to evidence your career capabilities in paediatrics so that you're level to somebody else who's already an ST3 trainee. So you've got an evidence form there, which is the core capabilities paediatric training, which needs to be completed as well. That's the only other document really that you'll need to actually attach to your application. Everything else will just be written into the forms themselves. But those documents, the core capabilities form and the person specifications, which have all of this eligibility criteria on them, are all currently posted on the college website. And the person specifications themselves and the more general information is all actually on the NHSE MDRS medical training site as well. So paediatric specialty recruitment as a whole, it's always formation, so therefore we recruit into not just England but Wales, Scotland and Northern Ireland as well. So when you're applying, you will have the opportunity to select posts in any of the 4 nations. The first process will be longlisting. We have a great team at the Paediatric National Recruitment Office who work out of West Midlands, who will be longlisting all applications, and that's based on the sort of basic eligibility criteria that you'll find in the person specifications and that I've just touched on. So longlisting, first process, then on to shortlisting. We do shortlist now beyond to ensure that actually there are enough interview spaces for the number of applicants, because the applicant numbers have increased quite a lot over the last couple of years, which is great, but it does mean that we are not quite able to interview everybody as we used to be able to. So shortlisting will be the next stage, and then if you get through the shortlisting process and get an invite to interview, you'll have a 2-station virtual interview. Interviews are, as I say, virtual. There are various different recruitment offices throughout the UK that actually manage the online stuff, but obviously because you're not traveling anywhere, it really doesn't matter where you take your interview anymore. So when the interview booking window opens up, you can apply to any of the dates that are available, and the whole process is known as a single transferable score process, which means that all the interview scores across all the different centres are held at the same level. So therefore, at the end of the process, all of those scores go in to make a final ranking score, and that's what you will get your offer on the basis of. So the application process and ORIL. The ORIL system, you may be familiar if you've ever applied to anything before, but it's the national recruitment platform. So it's a one-stop shop where you can apply, where you will get your interview invites, you'll get your shortlisting scores, and you will also then get an offer or an outcome at least at the end of the whole interview process as well. So it's all within the ORIL program platform. So if you haven't got an account set up already, I'd do it now. Make sure it's all ready to go before the application window opens, so you can go straight in and start looking at the actual application form. There is a link to how to do that on the web page as well, and also on the medical dental training recruitment selection website as well. But if you haven't got an account set up, do that now, because you will need to put in a certain amount of personal details in advance, which then gets sort of filtered through to your application. So from a national recruitment point of view, actually all specialties are recruiting at the same time. So it's not just the paediatrics that will open next week. It will be all the other medical specialties as well. So it follows a kind of annual process, which fits into 3 different rounds. So round 1 is for the entry-level roles, so for ST1, and that opens next week on the 24th of October, and that window runs for about a month until the 21st of November. ST3, or any of the higher level entry points, are all part of what's known as round 2, national round 2. They open slightly later, so the applications for ST3 are from the 14th of November, and again, just under a month. They will close on the 5th. So just as I was just saying, be aware of those eligibility criteria, the basic eligibility criteria from the person spec, because that should see you through long listing, therefore. And then just make sure that you also have a chance to refer to the shortlisting guidance in advance, so you can start thinking about the examples that you're going to use when you start filling out the paediatric specific part of the application form. So I've covered quite a lot of this already. But long listing and shortlisting, as I say, are both processes which follow the application window closing. I've just mentioned the paediatric specific section. So there are sort of 2 sections basically for every oral application form. So the first bit is a standard application form, which is for all medical specialties. So you might find the odd question in there which you think, is that right for paediatrics? Most of them, it will make it very clear whether it's just something that's just specific to a particular specialty. So just be aware of that. But most of it is just a standard application form, and that's where your basic details go, including kind of employment history and so on and so forth. And then that paediatric specific section is where you've got the kind of short white space questions, which is what you'll be shortlisted on the basis of. When it comes to shortlisting, it will be 2 assessors that will be scoring every application, and there's a window shortly after the long listing closes for each of those, during which the shortlisting will take place. So ST1 should be done by early January, and ST3 will then start the shortlisting process and will be done by early February. Interview invites will then come out via Oriel fairly soon afterwards, and I'll go through the dates in detail later on. And the interview booking process, it is basically first come, first serve. So keep an eye out for the interview invite, because the quicker you go in, the quicker you'll be able to choose the date and time which you would like to have. And those dates, the interview dates, will be posted on the college website as well. We're just waiting for final confirmation, but they should hopefully be on the website by early November at the very latest, the actual interview dates themselves. So when you get your invite to interview as well, just keep an eye out, because you will have an applicant declaration form that you have to fill in as well, and that needs to be returned when you're booking your interview. Otherwise, you may not be able to be accepted for your interview date. Preferencing. So as I mentioned earlier, it's a 4-nation process. So you can apply to any of the 4 nations and to any of the regions within those 4 nations. The preferencing becomes available after shortlisting is complete. So therefore, if you are invited to interview, then you will have the option then to actually start making your preferences. This is also all in Oriel. The interview, the program information will all be available from the start of the application process, so you'll be able to see the regions that are recruiting, as I say, on the website. But the actual ability to go in and select the preferences that you'd like takes place after shortlisting. So you can select as many as you like. So you could select, up to like 100, whatever it may be. If you really don't mind where you work, you just want to work in paediatrics. But just be careful what you're selecting as well, because the whole process of offers is dependent on the list of preferences you've made. So if you do select something that you don't want, and that's the only one that you get given in the end, then it does limit you a little bit, and you may end up having to drop out of this round and reapply next time. But don't limit your options either. If you've got sort of areas that are sort of close by to each other and so on, do consider them, and just make it careful, look at it all. You've got plenty of time to look at the preferences once they become available. And just to give you a rough idea of post numbers, for ST1, we're likely to have around about 450, 440 posts. ST3 is likely to be around about 60 to 80 posts, roughly. ST3 posts we should know later in November, and again, keep an eye out on the website for where they appear. But you can amend your preferences as well all the way through, and actually you can amend your preferences while offers are being made as well. So it's quite a flexible system. And just before I hand over to Simon, I'll just run through the interview format briefly. So the interviews themselves will take place in 2025. So SD1, there's a window from the 30th of January to the 7th of March. Most of the paediatric interview dates tend to go fairly early in that window. But as I say, keep an eye out for the actual dates when we're able to post them on the website, which should hopefully be, as I say, by first week of November. ST3, there are fewer days, so there's a shorter window. That's in March at the end of that other window, so 4th till 7th. And depending on whether you apply for ST1 or ST3, it's a sort of 40 or 45-minute interview. You've got 20 minutes in each station for ST1 or 17 minutes in each one for ST3. It's 2 stations with 2 different types of scenario in each, which we'll run through in a moment. And you've therefore also got 2 assessors in each station who will be assessing those. When you get your overall score at the end, in order to be appointable, which basically means that you are in the running to be made an offer, you need to reach 55%. And then that overall rank, as I say, that gives you the opportunity to be offered a post is based on that interview score alone. So once all the interviews are done, everybody's scores get pulled together. There's a national ranking, and then those preferences get offered out. I'll come back to offers at the end, but I'll give you all a break from my voice for a moment, and I'll hand over to Simon, who will go through the ins and outs of the actual sort of areas you're going to be scored on.
Many thanks, James, and many thanks everybody for joining us tonight. This is the biggest number we've had attending a webinar. Over 300 people have attended, so thank you. And firstly, I hope this is really useful information, but also disseminate it to anybody else that you know who's applying for paediatrics. So for those who have never applied before, this won't be a change, it will just be a new process. But some of you will have applied for ST3 before, and it's a change from the previous shortlisting format, which may be a bit anxiety provoking. But the reason why we've made these changes, as James said, is really to make it fairer and to kind of give consistency over the marks, so that we're actually awarding marks for the content that is written down, and to get less variability between scorers. So hopefully it just makes it a more fair, transparent and auditable process, which is obviously key. So when we say there's no more long white space answers, we're kind of telling a bit of a fib, really, because there's 2 clinical areas that you will be filling out for the shortlisting. So one is on examples of clinical of skills, and one is on experiences. And you will describe those skills and experiences, and then you will also then talk about your reflections of how they've helped you in paediatrics. So there's 2 boxes per clinical shortlisting box, and each box you have 5 examples you're going to be putting down. And in each example, you have 2 boxes where you can write 50 words each. That's a really complicated way of saying that basically you still have 500 words for each of these sections to write about what your previous experiences are and how you've reflected on them and how they're relevant to paediatrics and what skills you've achieved. So for those applying to ST1, we know that many of you will never have worked in a paediatric post, and we don't expect you to necessarily put down any paediatric posts or experiences or clinical experience, but we do expect you to put down other experiences, other skills you've achieved, and then talk about how they're relevant for a career in paediatrics. Obviously for ST3, it's purely paediatrics, and we want more detail about how those things are relevant to paediatrics. So it's still 500 words per section, and you will be scored, however, on the kind of best ones. So, but we encourage you to use all of those spaces to write your information. As James said, some of the items are entered via drop-down boxes, and then in terms of examples that we're looking for, skills that could be relevant to the specialty would be things like handover, communication, teamwork, escalation, demonstrating a leadership within a situation, practical skills, communication skills, etc. So the things that you can talk about that are relevant to pediatrics are absolutely huge. In terms of the quality improvement or research project, all of the other sections, apart from the clinical sections, we're only looking for 2 examples rather than 5. So you have 200 words per section for those, and that includes your quality improvement, your teaching, and your research, and leadership if that's relevant. So here we are asking you to write your best example of something that is relevant to a career in pediatrics. And the key thing here, as with the clinical one, is to make it relevant, but to make it succinct. So having done research to a high level, I can tell you writing succinctly is quite challenging. So I would suggest that you write these things initially in Word, really look at them and make them as succinct and accurate and as good as possible to demonstrate everything that you've achieved in your career so far. So next slide, please. So in terms of the application form itself, it goes through this in the order. So additional qualifications. So additional qualifications are things that you've achieved after your undergraduate degree. So intercalated degrees do not count. This has got nothing to do with us as paediatrics, so please don't complain to us. This is a national guidance across the whole of the country for all specialties. And really, there's lots of reasons for it, which I can talk about. And whether I agree or disagree with it is irrelevant, but it's something that that we don't have any choice about. So additional qualifications would be a postgraduate MSc, MA, MD, but the MD has to be a university awarded MD, not a clinically awarded MD, which is given in some countries. It has to actually be a research diploma, which has been marked by a university, and as opposed to the end of a 3-year training period. And that's awarded in certain countries around the world. It has to be a university awarded MD. So then we've got the clinical experience and reflection boxes that I've talked about. So for ST1, we're looking at transferable skills rather than necessarily pediatric skills. Quality improvement and audit, leadership and management for ST3, and academic achievements plus research for ST3. So in total, there's the total score down below. It's not necessarily relevant what the score is. The key thing is to score as many points as possible. And as James said, you really need to go onto the Royal College website and really look at the scoring framework, what it is that we're going to be looking for when we are shortlisting, and then mapping your application form exactly to that. Next slide. So we asked 100 paediatricians, what do we think good paediatricians should be? And we genuinely did ask about 100 paediatricians, and this is what they came up with. And this is for ST1, and I guess the first thing I'd say is what you don't see there is the word knowledge, which is great, because if you can't train knowledge in 7 years of training, then obviously you're not training very well. So the knowledge will come with time and as part of the training process. But these are the things that we really want to get to at interview and at shortlisting, to identify that you have these skills. because these are what we think are going to make the best paediatricians of the future. And these are generic competencies that you will achieve at foundation level or within that bit of extra time of training that you do before you apply to ST1, but you don't go to 2 years. I'll give you a bit of a chance to look at that slide, and then we'll move on. Next slide, please. So the interview, they are different. As James said, basically each interview consists of 2 20-minute stations. In each 20-minute station, you're marked by 2 interviewers, and then you'll come out and go into the next station where you're marked by a different 2 interviewers. The whole process is run by the National Recruitment Office and works very smoothly. So for ST1, you will start off straight into a communication station. You'll be given the opportunity to read the scenario for 4 or 5 minutes before the communication station starts, which is plenty of time. There's no interaction with the interviewers at all. The assessment is purely based on your ability to communicate with the role player who is playing a person, which is either a parent or it's a teenage child. And you'll carry out that communication scenario, and you'll conclude that at around about the end of 10 minutes. And you'll then move on to career motivation, which is when the 2 interviewers will appear, and they will get you to talk about your career so far and how you've prepared yourself for a career in paediatrics. We have some instructions in the guidance that can help you to prepare for things that we're looking for, but the key is to demonstrate what you understand about paediatrics and what makes a good paediatrician. We would like to hear about your role models, and what attributes that you think are essential to be a good paediatrician, or even just a good clinician, because they're pretty similar, but in particular around paediatrics. Your next 20-minute station will start off with clinical reasoning. So this is a clinical scenario, and as with the communication scenario, the case that we will be talking about will be a case that you won't have needed necessarily paediatric experience to complete. So it will be at least 6 years old, if not older, and it will be based around a condition that you would have seen in adults, so such as asthma, sepsis, seizures, diabetes, infections, pneumonia, etc. We're really, really not looking to catch you out. They are, very standardized questions which we think are fair. Gone are the days where we ask about, the biochemical changes that you see in pyloric stenosis, etc. They're very standardized questions, but they do allow us to discriminate between the preparedness of those that are actually applying. And the final station, and we will print the wording out verbatim in the application guidance, is on reflective practice. And here we want to hear about your what you've reflected on around a particular situation you've been involved in, which probably won't be paediatric, but it might be, and what you reflected, how that reflection has really helped you in to think about a career in paediatrics, and how you're going to move forward following that event, which can either be where things have gone well or things have gone less well, and then think about how we use reflection in day-to-day practice and how you share your reflections with others. So next slide. So ST3 is slightly different. So the communication scenario is the same as I've just described. Clearly, the clinical case is much more complicated. So it could be a neonatal, could be a safeguarding, could be, a child who needs transfer from a district general hospital to a teaching hospital. It will be a high-level clinical case, because if you're appointed at ST3, essentially you're being appointed into middle grade. So you need to be able to handle these situations independently, pretty much at the point of starting. And that's what we're looking for. When we appoint ST3 trainees, we're thinking as consultants, do I feel safe with this person being my registrar on call pretty much from day one? So it's a high bar. So after the comms, we move into reflective practice, which I've just previously talked about. And then you'll go into the other interview panel, and the first station will be on clinical reasoning. Again, it will be a significantly more challenging case than I've just described for ST1. And we'll expect you to talk for about 10 minutes on your management of that case. Again, we're looking for somebody who we think is going to be safe and ready to start on the middle grade rota from the point go. And then we move on to governance and leadership. And this will be thinking about where something may have gone wrong, or how you use audit and quality improvement projects to actually improve the quality of the service that you're providing. So again, these things will be read out to you. So for the communication station for both ST1 and ST3, you will read the information. For the clinical reasoning, governance and leadership in the other stations, the interviewers will read out the wording to you. So we're testing both your ability to read and then to move on and to have a communication. And we're testing your ability to absorb information that's given verbally and to deal with it in a clinical manner. Next slide, please. So I'm handing over to Blanche now, who's going to move on to hints and tips.
Thanks, Simon. I'm sorry if I duplicate any information that you've already heard, but I've been trying to keep an eye on the Q&A, so hopefully it'll just be some confirmation of some other things if you've heard it already. I think really importantly, oral accounts do take a bit of time to set up. James has already mentioned there's nothing stopping you setting up this week, so even if you're not applying for paediatrics or applying for something else, I would make sure that you set that up and make sure there's no problems. Any issues with Oriel itself, the college don't run it, so you need to contact Oriel directly and make sure that your account's set up, and that will just reduce your stress when the applications open next week. I think this is standard for most things. Don't leave it until the last day to submit your application. You already know the different things you're going to be asked, because all of that is available on the website, so you can start writing your application now even though it's not open, and at least get your ideas together, and then it's just about transferring it into the areas of the website, so you can start thinking about what skills or examples you're going to use and start thinking that through, because that's the bit that often takes a little bit of time, and then once the application's open you can start filling it in. There can be delays, if you're pressing it at 1 minute to the closing and your internet's not perfect and you miss that cutoff, that you've missed the cutoff. There'll be no appeals for that, so do make sure that it's entered into on time. Just to flag that you will get contacted via Oriel account, and they often email you, and then if you log on you get little flags to say you've got messages. They can be quite easily missed, so just make sure that you're looking out for messages from Oriel itself rather than from the college, and as we will contact you about application, interviews, things like that, all through the Oriel setup, and often it will say your status has been changed or something in the email, and then you need to log on. So just make sure you don't miss those emails, so you don't miss any deadlines. I think Simon's talked a bit more about the interview and preparing for it, so I won't go into that, but I've seen a few questions for the white space questions about skills versus experience in the clinical bit, so I'll touch on that instead. I think as doctors, we often think a skill must be a practical skill, and it means cannulation or lumbar punctures, but a skill can be any skill that you think a paediatrician would have. So that can be things like teamwork, can be things like communication, even simple things like how to take a good history from a teenager or a child. They are all skills that you have that will make you a good paediatrician. Experiences there probably will be some overlap, but you're talking more about things that show us that you know what it means to be a good paediatrician. So you recognise the skills you need, but also maybe the experiences or the things that have shown that you understand what being a paediatrician involves. And that might be breaking bad news, for example, is a skill, but you might have had the experience of watching someone break bad news, so you haven't done it. And how you reflect on that and what you've learned from that is what will get you the higher marks in that section. We can talk a bit about that in the Q&A, because I think there's a few questions about that. I hope that makes it a little bit clearer. for ST3 in the information that's on the website, there are some quite clear guidelines of what you need to include, because you do need to include, I think, one neonatal, one safeguarding in either the skills or the experience. Sorry, I can't remember which one. So if you're in ST3, just make sure you read that detail, because I don't want people to miss out because they haven't read it. I don't think we're quite to the place where people have done all the interviews in their life virtually, but everything has gone to virtual now, so just treat it like it's a real interview. We'll send you links, make sure your internet's good, make sure you're not going to be interrupted, dress as though you're attending the interview in person. Some people go as far as to put shoes on and things. I'm more of a top smart, bottom shorts kind of person, but as long as you feel in the right mindset and you feel like you look professional on screen, that's the most important thing. I know people who've left the house and then walked back in, so they've got in that interview mindset. So make sure you don't shortchange yourself because it's at home. You want to prepare as though it's in person, and make sure you're looking professional on the screen. And then just touching on the preferences, so don't limit where you pick places you'd go, and definitely consider places you might not consider. You can reach out to people who are working in different centres. There's deanery reps on the college website for all of the deaneries, I think, currently, apart from maybe Wales, but I worked in Wales, so you can always contact me for that. If you're interested and want to know a bit more about it, then feel free to do that, because I wouldn't limit where you pick. But please don't, we try to discourage you picking somewhere you really wouldn't go, just because if you're going to turn it down anyway, it actually limits you, because you would have to agree with upgrades, which means that you might end up there. So just think carefully about your preferencing. I think they're the main points. We'll probably go on to the Q&A, because I know people have got quite a lot of questions. Or actually, I think James has got one more bit, and then we'll go on to the Q&A.
Fab, thanks, Blanche. Okay, yeah, just a couple of last bits around kind of process and dates and times from me. So just to go over the offers process. So once all the interviews are complete, as I mentioned earlier, all the scores from all the interviews will get pulled into a national ranking, and then based on where you've listed your preferences, that's the way that the offers will be released. So essentially, the higher up the list of scores and the national ranking you get, the better chance you have of getting your first choice. Oh, excuse me. The initial offers are out towards the end of March. Every time you get an offer, you have 48 hours to decide what to do with it. You've got 4 options. So you can accept it, or you can accept it with upgrades, you can hold it, or you can decline it. If you get your first choice, then I would suggest you're probably happy with it, and you just accept it. Accepting with upgrades is if you don't get your first choice, and you hope that you might get sort of something better in the next iteration of offers. So there's usually, certainly for ST1, a couple of weeks worth of iterations of offers. So there's plenty of opportunity there for things to move around. And as I mentioned earlier, you can change the order of your preferences in the middle of that process as well. So those are the sort of 2 options for accept. As I say, if you get your first choice, accept it. You're done. Brilliant. Look forward to starting your paediatric training. So the hold option is always the one which is slightly confusing in a lot of ways, in that holding, you would hope, would actually mean that you can hold an offer in more than one application. But actually, if you have applied to other things as well in the same round, if you start holding one offer, it will actually knock you out of the other one. So say you've applied to ST1 Paediatrics and you've applied to GP. If you hold one of them, you will be knocked out of the other one immediately. So unfortunately, it's not quite the hold you would hope it would be. It's more, if you think that's definitely the one, you're not worried about upgrades, and you just want a little bit more than 48 hours to decide what to do with it. And then obviously you can decline it as well. So, if your circumstances change, if you end up getting one that's really low down your preference list that you decided actually you don't really fancy. But just to say that as soon as you've declined a post, that is you taken out of this year's process. So you would have to then reapply it the following year to try and get a better offer. As I say, usually a couple of weeks for ST1, week or so probably for ST3, there will be multiple iterations. So that's another one of those situations where, as Blanche said, just really keep an eye on your Oriel account and keep an eye out for those offers emails that will all come from Oriel, and we'll mention status changes and so on as well. So full timetable for both rounds are on the college web pages at the moment. You've also got all of that in the central MDRS and HSE training website as well. But just to head a little bit beyond what we were saying earlier about applications. So the interview booking will come out very quickly after the shortlisting's closed for ST1. So make sure you're available to do some interview booking on those 3 days, 20th or 22nd of January next year. So they tend to go quite quickly. So try and be ready with your application, your ORIL open, and then the interview window, I think I've already touched on. So just to confirm, 18th of March will be when the first lot of offers for ST1 go out, and they'll be by 5 p.m. in the evening. It could be a little bit earlier. But it's quite a long process, so therefore, don't expect it to be there by 10 o'clock in the morning, absolutely, but should hopefully be there sometime in the early to late afternoon. And then that whole deadline, I say, if you do want to hold, there is a deadline at which point anybody that's holding anything, it automatically gets rejected. So just be aware of that if you do decide to use that hold option. For ST1, it's on the 3rd of April. And then R2, so round 2 for our ST3s. So again, interview booking, it's a very short period, three days there once the shortlisting's completed in February. So again, make sure you'll buy your ORIL account. And then the offers for ST3 are going to be out on the 26th of March with a hold deadline on the 23rd of April. Which will probably be at a point when it's all well tied up anyway, but just have that in mind in case. And just a final point around GMC registration, which will apply obviously to people who are working outside the UK. So just a reminder that GMC registration is the applicant's responsibility. So you need that in order to be able to practice in the UK. So if you are applying from overseas, you need to make sure that you actually start up the process yourself. It doesn't come as kind of part and parcel of being offered a role. And actually, if you haven't got your GMC registration sorted in time for your post to start, then you may end up not being able to take up the post. Obviously, places will be as flexible as possible, but with all the sort of inductions and so on that are required, you need to be there when your post starts. So posts for round 1 and round 2, ST3 and ST1, they will start in August, September 2025. Different regions start in August, different regions start in September, but you'll be able to see the dates when you're preferencing. Make sure you got your GMC registration sorted well in advance of that so that you're all ready to go. So there's more information on that in the applicant guide, which lets me segue into this little last slide about guidance. Let's say most of the information, most of the in-depth information about paediatrics is all on our website, on the RCPCH website. You've currently got the person specifications and the shortlisting up there, and also the overview of dates and also of the interview format. The applicant guide, which we've mentioned a couple of times, should be available by next Tuesday at the latest, hopefully. Just waiting for that to come through from Peds NRO with the last sort of bits of information in it. If you want any general information that covers all of the different specialty applications and so on and so forth, HE or NHSE now, actually, I should have changed that, apologies. Training website has got all of that information on it as well. Links to that are on our web pages. And finally, if you've got any queries during the round, then they do need to be directed to our Peds NRO team, our national recruitment team, and that's their website address there. So we'll have this website, this webinar recorded, and it will be on our YouTube channel and linkable from our web pages as well from next week. And that is all the talking from slides, certainly, that I'll do. We'll move now on to some questions, and hopefully Blanche has had a chance to be keeping an eye on these. I know we've answered a couple in the chat already, but I'll hand over to you to run through this.
Yeah, so I've tried to group them together. If there's any I don't think we'll get to, I'll try and answer them in the chat. But if we don't answer a question, then after the webinar, just feel free to email the college the emails on the recruitment pages. So there's quite a few questions that we normally get a few, James. I think this is for you about CREST forms.
Yes.
So along the lines of the time frame in which it needs to be signed, if it has been used last year, can it still be this year? And someone just querying about if it's a if it's an academic supervisor signing it, what they need to evidence.
Okay, so I can answer most of those questions. I might need to just double check about the academic supervisor bit, but certainly, so if you are filling out a CREST form, so that's the one that you evidence your foundation capabilities on, the snappily titled Certificate of Readiness for Entry and Special Training. So that was updated in 2024, and for this year, you can use either the 2024 form last updated in 2023-24. They will both be accepted in 2025. So long as it's one updated from 2023 or 24, you'll be fine. But before that, you'll need to transfer it onto the new form. It's 3.5 years is the signatory time, so it needs to be basically signed by evidence that has been observed in the last 3.5 years by the person who is actually signing it off. So essentially, yeah, it needs to be somebody relatively recent, but it's a 3.5 year deadline. And sorry, Blanche, you mind just saying that academic supervisor question again quickly?
Oh, yeah, let me just find the exact wording. So I think it must be someone who is, it says, what are the necessary documents to present for a CREST signed by an academic professor, PhD, MD, in their contract with the university? Like, is that what they have to provide?
I mean, every CREST form, you need to obviously have evidence of where the person works and so on and so forth. I mean, it is basically foundation clinical skills, so it needs to be signed off by somebody who's a consultant. So I suppose it might be worthwhile just emailing Peter about that one, just to be absolutely certain that the person that you're asking to sign it is eligible.
So just to clarify for that, the CREST forms, James is saying contact Peter, right? Because they are something you'd have to fill in for all the specialties. It's not something specific to paediatrics.
Yeah,
so,
CREST is for all ST1 entry points.
So they'll have more information.
Yeah.
Great. And then, so that's most of the CREST form questions. I think the next one might be for you, Simon, about clinical experience. There's been a few questions, so I'll ask you one at a time, don't worry. The first one is about the limit on previous experience and whether it needs to be UK based or whether that 2 years is anywhere in the world.
So it's irrelevant. Children are children wherever you are. So 2 years of experience at the point of application in whatever country you're applying from. And whether you've been in Australia or anywhere in the world, it's maximum of 2 years at the point of application. And as James said, if you've worked in an emergency department where you're seeing adults and a few children, that does not count. But if you've worked in a paediatric emergency department, that absolutely does count.
So linking quite nicely to that, Alyssa's asked, if you have 2 years of experience in paediatric A&E, but then you don't have your 6 months of neonates and 6 months in general, what could you apply for?
So if you've only got 2 years of experience of paediatric A&E and you have no other paediatric experience, you would only be able to apply for ST1. To apply for ST3, you need to have 6 months that you will call general paediatrics, of which paediatric A&E would probably be acceptable, but you'd also have to have 6 months of neonatology. So you would not be eligible to apply for ST3, certainly without neonatal competencies.
And just for clarity, I think, because it sounds like she works specifically in paediatric A&E. If she's already got 2 years experience, would that preclude her from applying at ST1? It's a little bit nuanced. Yeah.
If she has more than 2 years of experience, it would preclude her, absolutely. In which case I would suggest she goes and does some other paediatric experience and gets some neonatal experience and then applies at ST3.
And just to mention, actually, from a point of view of ST3, we do have a second ST3 intake these days. So if you aren't able to get into this ST3 intake and you are able to organise a placement of that sort, then there is what's known as round 3, which recruits for places that start in February, March 2026. So that recruitment round starts in July next year. So yeah, just a little bit of a delay, but not a whole year, essentially, if you're able to do that.
Yeah.
And then there's quite a few questions about postgraduate qualifications. So people just asking about intercalated masters. So no intercalated degrees are included. That includes intercalated masters. Someone just questioning a BSc done pre-medical school would also not count. Simon, is that correct, Simon?
So no, so they won't get you the point for the extra qualification. But all of these things, can be written down in experiences, so these things might be relevant experiences that you would describe and how they've prepared you for a career in paediatrics. Obviously, if you've done any research from those, then you could describe those in the research section, or if you've done any teaching during those times, you could describe that in the teaching section. But yeah, no intercalated degrees count, and this was a national push. It really it's across all specialties in the UK.
Thank you. And then a few people asking if MRCPCH would count as postgraduate certificate or a fellowship in paediatrics, or someone's also mentioned RChem as postgraduate exams, if they would count.
So
for ST1, none of those would count because we don't look at counting qualifications towards membership for ST1. And for ST3, then you would need to have some of the written parts of the membership before applying. But those things are not university given postgraduate qualifications. So they unfortunately wouldn't count. They are fantastic and will help you with your experience section, but they won't score. And it's a very small scoring box anyway. The points that you get for extra qualifications, but it is purely for those really who have done a postgraduate, a post-medicine master's or postgraduate diploma or certificate, or have a formal university acquired MD or PhD.
Thank you. And then James, a bit more of a straightforward question. When would the preferencing close? So when can you stop altering your preferences?
At the very end of it all, you can keep changing your preferences all the way through offers. So it's, I can't remember what they call it now, it's like flexible preferencing or something. But essentially, if a round of offers goes out and either you don't get something or you get something which isn't your first choice, you can then tinker with your list of preferences, perhaps take off a few that you say you don't want anymore, and then when the next iteration of offers comes around, it will be based on that. So it's very flexible and it's open, as I say, all the way up to the end of the offers process, which will be when they've basically exhausted the ability to offer posts to appointable applicants.
Perfect, thank you. And then there was just a few questions along the lines of, I've lost it. Whether things need to be in paediatrics. I think we've always said that you don't need to have specific QIP or audits in paediatrics. If they are, fantastic, but if not, you've still learnt skills. And I think that's probably true at ST1 for your clinical skills and experiences. Obviously, fantastic if they're in paediatrics, but there are definitely skills from other areas that you could bring across. So don't feel that you can't talk about something you learnt in orthopedics, for example, that there's no limit that it has to be linked to paediatrics. I don't know if there's anything else about that, Simon, you wanted to mention.
No, I think you've said it all.
There's quite a few kind of very specific queries for people about research questions and what something would count as. I think we can't answer everyone's specific with this count for this. If on reading the guidance that's on the website, that is very detailed, and we're not trying to trick anyone. It clearly says you'll get 1 point for this, 2 points for this, or this is the drop down boxes. If anything's not clear after reading those, then you can always contact the college for a bit more information. But we're not able to give you the exact answers. We're not scoring the applications, so it will just be information based on that guidance. So if you do have specific queries, then and you really don't think it's clear, please contact the college, but a lot of it is explained quite clearly in the guidance. A few questions about if things will count if they're submitted for publication, or for example they've booked their exam. I don't know if you want to answer that, Simon or James.
So we normally don't count those. You can talk about those in the research section if it's obviously going to be an excellent publication and it will be considered, but you can only really be awarded points for a publication. So I would definitely add it in. It's something you can put into your experiences section, and the experience that you've had, which is more around clinical skills, but you would have learned stuff that's still relevant for paediatrics during that. But yeah, we tend to mainly award points for articles that have been published, which I accept is Not always the the kind of easiest or fairest, but it is the way that we score nationally.
And then James, I think this one's probably for you. I think you said this, but I might have missed it. Does your interview score get combined with your application score for final allocations, or is it just your interview score?
No, your final offer will be based just on your interview score. So your shortlisting score gets you to interview, hopefully, and then your offer will be based just entirely on the score you get at interview. So there's no combination of the two.
And then there were a few more questions about clinical experience. So someone did ask, would their level 2 neonatal experience count in a DGH as their 6 months experience?
Yeah, if they've done level 2 neonates in a DGH and they are able to independently manage a term or even a preterm, but definitely a term baby on the labour ward and help out with managing them on the neonatal unit, then yeah, 6 months of level 2 would be adequate. Yep.
Just to follow on that as well, when the ST3 applicant guide is available, and that will again hopefully be by the start of November with any luck, it's got some quite sort of specific outlines of exactly what sort of levels of neonatal general paediatrics would be accepted. So hopefully that'll crystallise it a bit as well. And just because I've just noticed a couple of questions come through on it, just to reiterate that those 6 months of each, you need to be able to evidence them on your application form. So they need to be completed by them.
Thanks, James. Someone just asking if they need to attach any evidence to the Oriel website. I believe it's just the CREST form that they're needed to provide. Someone else had asked about evidence about poster presentations. We don't ask you to provide the evidence unless it's published and you have a PubMed ID. I think that you can put in. We're trusting you to be honest. If anything then's raised that it was dishonest, then we'd have to raise that with yourselves or your supervisors.
Yeah, just to say that, yeah, CREST for ST1 and the paediatric core capabilities for ST3. So it'll only be one document for either entry. And yeah, we've had a couple of questions asking about the ST3 core capabilities as well. There's a version on the website now, basically, as long as it's one which is based on Progress Plus curriculum, so this year's or last year's, that'll be acceptable.
Thanks. And then just coming to the end now, so probably one of the last couple of questions. Will the interview panelists have any access to the applicant's application pre-interview?
No.
Yeah, short and sweet. So no, they don't have any access. You have to really, anything you want them to know, I always said to people, you need to tell them in the interview. So if you think it's a really important piece of information about you as a trainee or as an applicant that you want them to know, you need to make sure you get that across. So when you're doing the interview prep, have a think about those important points that I think you sell yourself.
Yeah, definitely don't assume any prior knowledge of anything you've done. Just go as if that's the first time in also, because it will be.
And then just a few kind of easy, quick ones we can finish off with. So research and teaching done during medical school, okay for ST1 applications? Yes, that's more than fine. The same with things we often say outside of work, if it's not clinical, not so much for the clinical examples, but for teaching, if you teach in a non-clinical thing, you can use that as an example, because not everyone will have done a lot of maybe in work teaching at ST1 especially. We probably want a bit more at ST3. Someone just saying if they put a qualification in that isn't accepted, would they be able to update it to a different one as if it wasn't clear what would gain them points? I think no, what you put in your application is accepted as what you've put in your application. So if you're not clear, you should clarify before you submit. And then just someone asking about change in practice. So in the QIP, does that mean observed practice change during the QIP or suggestions that are made and changed? So that would be you completing your quality improvement project, suggestions for change, and then an actual change in the practice. And then perfection is if you re-audit it or QI it to show there's change in practice as well. That would be gold standard.
Yeah.
And that brings us to 7:30. I've tried to quick fire a few. If anyone's got any burning questions that can't, actually, this one I will just finish on because it's been asked more than once. Can you use the same experience across 2 domains?
Yeah, you can use the same thing in different domains. Absolutely. It's you're looking for scoring the points in each area. But if it's applicable across 2 different domains, that will be fine. Yeah.
That will now genuinely be the last question, and I'll just leave it back to James to close.
Thank you very much, Blanche and Simon. Thank you to everyone that's attended. Yeah, amazing attendance, brilliant. I'm really pleased, and hopefully that means we're going to get lots and lots of very keen applicants this year. Just to say, we're wishing you all the very best. I say keep an eye on the website for any updates or any of the documents that I said are still outstanding that are going to be coming in the next couple of weeks. And hopefully you've got some really useful insight now into your application as well. So yeah, wishing you all the very best. Many thanks to my co-speakers, and just to remind you that this will be recorded, well, this has been recorded, and will be on the website as well sometime next week. Thank you very much.
Thank you.